Hey everybody, it's Wednesday night as far as I know. Kind of starting to get all the days mixed up. And I talked about having a live Facebook feed tonight, kind of about our virtual visits that we're having, as well as just talking about how we assess, how we look at you guys virtually and online. And how that works, because we had a lot of people asking some questions, so I thought I would hopefully be able to answer those for you tonight. So basically, because of the government mandate, we have been mandated to shut our clinical doors. However, it's opened a new kind of opportunity for us to reach out to all of our patients virtually. And people say, well, what do you use? What platform do you use? We basically use a upgraded version of Zoom through one of our physiotherapy platforms. So we're doing kind of like a face-to-face, FaceTime, Skype, WhatsApp, but just a kind of PIPEDA and HIPAA compliant, which is basically your privacy and confidentiality legislations for Canada. So we've been doing those over Zoom, and it's been amazing. We've had some really good feedback from everybody. So what I wanted to kind of explain to you guys is basically how we look at you virtually, which is kind of cool. And I did a post earlier today just kind of asking everybody a couple of questions, especially those of you that, you know, have been suffering with pain or discomfort or, you know, an ailment for, you know, whether it's been a month, whether it's been 2-3 months, that sort of thing, and if it's been lingering. One thing that I always ask my patients is, are you moving poorly because you're in pain? Like, so are you starting to move differently because of your pain symptoms? Or are you in pain because you're moving poorly? So people always kind of have to take a double take at what I just asked. And the reason that I say that is a majority of the time that we experience symptoms, whether it's sharp pain, achy pain, that sort of thing, usually it's cumulative unless we have an actual mechanism of an injury. You know, you fall down the stairs, you twist your ankle. Well, you hurt your ankle because you twisted it. Or you threw a baseball and, you know, you tweaked it because you went too far. Those are specific injuries, but a lot of the time we have injuries that come and why you're having symptoms. So when I kind of meet with somebody virtually, we usually have the conversation of kind of the history of everything that's happened. How long have they been having symptoms? When did it start? How would they describe them? You know, what makes it worse? What makes it better? And then that gives me a really good kind of subjective history of what their symptoms are going on. And most of the time I'm able to decipher a couple of different ideas. We call it a differential diagnosis, just different ideas of what could possibly be going on. And then that kind of opens up a lot of doors with respect to our objective assessment, which is basically when we watch you move. So we're going to talk about 3 different things today. Usually when I assess somebody, virtually especially, I look at 3 different things. I usually do my clearing tests, all that kind of stuff, special tests if I need to. But the 3 things that I look at: flexibility. I'm not sure if everybody knows what flexibility is, but flexibility, mobility, stability. Okay? So flexibility is basically the ability of our joints and bodies to move, specifically the muscles that cross them, and how flexible they are and how far you can move, okay? And it kind of directly correlates with mobility. And people say, well, what's the difference between, you know, flexibility and mobility? So flexibility is more the soft tissue structures, flexibility. Mobility is more so the degree that your joint moves. And your joint is basically where 2 bones interconnect. So elbow joint, shoulder joint, right? We call it an articulation. So basically one bone meets another bone. That's a joint. So your mobility is basically the ability of your joint to move as long as there's no restrictions of the soft tissue. okay? So the two of them are kind of interrelated, I guess you could say, flexibility and mobility. And then we talk about stability. So stability is more so the ability to control movement. And that's when you start to see kind of muscle strength, coordination, motor control, basically the coordinating actions of the tissues and that kind of neuromuscular control. So neuromuscular control means basically that connection between your muscles and your brain, right? So is that signal fast? Is it slow? Do you need to train it? Do you not need to train it? Tell patients when we do their assessments is, how are you moving? So I take a look at you. I have a couple of different functional tests that I do. I get you to squat. I get you to rotate. I get you to, sit in different positions and move. What I'm looking at is how you move. Do you look like you're moving properly? Is it equal between the left and the right? So the first two things that I'm always checking is your flexibility and your mobility, okay? If your muscles are stiff, it's not going to allow your joints, which is you, to have full mobility, okay? So flexibility has a huge, huge effect on your mobility. Now, once we take a look at your flexibility and I say, hey, you know what? You're great. Your muscles are nice and loose. Let's take a look at your joint mobility, okay? So we're gonna look at how you move, how far you can move, how far those joints can move. And then we also look at the stability and how well you move, your quality of your movement, different from the left and the right. How good is your balance, right? How good is your balance under different stresses, under different movements? Can you balance on one leg? Can you balance on one leg while I throw something at you? Can you balance on one leg and touch your toes? Or can you simply balance on one leg and keep your pelvis nice and level? Or do you kind of shift or do you deviate? Assessment is really the coolest aspect of being a physio, is being able to decipher what's going on with you. Okay, so as an example, I usually give this people an analogy. You're driving down the highway. You get a flat tire, right? You pull off the side of the road. Could you still drive with a flat tire? Yeah, a little ways, right? But what do you do when you get a flat tire? If you pump up the tire full of air, you could probably go a little bit farther, but you're going to come to a halt again, right? So I see a lot of people come into the clinic and, they've seen a massage therapist, they've seen a chiro, and they get better, but then they regress. They get better, and then they regress. So I always say the physio is a great kind of collaborative treatment alongside your massage therapy, alongside your chiro. We are trying to come to the decision of why you're having symptoms. So a lot of the times we will treat we will treat the cause of your symptoms, okay? So when we go for a massage, it loosens up the muscles, it allows us to move better. But what we have to try and decipher is why that's happening, right? So we're trying to get to the root of your symptoms, and we're not just treating the actual symptoms, we're getting to the cause. So you fill up your tire, you drive a little bit farther, then you break down again. What you have to do is you have to patch the tire, then fill it up, and then you can head home, okay? So that's basically what we're doing as a physio. We are trying to find that missing component to why you're having pain, fix it so that you can keep on going, okay? And what we're looking at is those three different components that I talked about. Your flexibility, what's missing, what's tight, what's not tight. And then we're taking a look at your mobility. How are you moving? How is your joints moving? And then your stability. Once we have flexibility and mobility fulfilled, how can we strengthen that area? How can we stabilize that area? How can we improve your motor control? Remember, motor control is that signal between your brain and the muscle, the signal between your brain and the ligaments. How can we stabilize that area so it doesn't keep occurring? Okay? So as an example, I had a lady with low back pain today. She's had low back pain for 6 years, on and off. She can go from, doing some physical activity, and all of a sudden, 2 days later, she can't put her socks on. She can't bend over, can't put her shoes on, can't tie up her laces on her shoes, and she does not know what to do. So what I said to her is, okay, let's take a look at what's going on. So we took a look at her flexibility. We checked her hips, we checked her low back, we checked her mid back. We checked it, just general movements, touching her toes, arching back, rotating, that sort of thing. And then I said to her, okay, you definitely have a couple of things going on in your hips. And she said, my hips? And I said, yes. And she said, what do you mean my hips? My pain's in my back, like back, on the right side. And I said, well, your hips have a huge impact on your back, okay? Always remember, where your symptoms are does not mean that that is the main reason or the main cause of what's going on. The joints above and below always have a huge impact on how we move. Okay? So I said to her, you've got a kind of an SI sacroiliac, which is basically the joint in between kind of your hip and your tailbone. You've got an SI irritation. And she said, I don't even know what that is. So I showed her a picture, kind of explained it to her. And we took a look at other things. We took a look at her mid-back mobility, because her low back movement was actually really great. She could touch her toes. She could arch back. But as soon as I took a look at her mid-back and I took a look at her hips, tons of stuff jumped out at me. But it was all stuff that we could fix. So when the few things that stood out to me, we took a look at her mid-back. I asked her to rotate against a wall. She could rotate significantly better to the left side, and she couldn't rotate to the right at all. It was about half of the range compared to the other side. And then I said, okay, can you balance on one leg? The left leg, she could balance great. Her hips stayed nice and level. Her shoulders stayed nice and level. She was great. Then, via virtual, I asked her to stand on the right leg. You know what she did? She completely leaned to the right. And I said, do you notice a difference between the two sides? And she said, yeah, I'm leaning to the right. And I said, yes, you are. And then I asked her to squat. So she squatted. It was an okay squat. Would I say it was great? No. And I told her it wasn't great. She laughed. And then I asked her to do a one-legged squat. Left side, she squatted. It didn't go very deep, not very stable, but she was able to do it. Then I asked her to do it on her right. She couldn't do a one-legged squat. Her knee buckled inwards, her hip buckled inwards, and she fell inwards. And she said, well, what does that mean? And I said, you probably have a little bit of glute weakness. And she said, what's my glute? Then I explained what her glute was. So your SI joint is stabilized by your glute. Then we did another couple of flexibility tests of her hips, and we found some stiffness in one of the muscles in her hip. That was impacting kind of the position of her SI joint, probably just causing a little bit of irritation. And then her glute muscle was not able to stabilize the joint. So for her, she had the flexibility issue in her hip, anterior hip. She had the mobility issue in her thoracic spine, which is basically your mid-back. A lot more common than you think. And then she had the stability issue in her SI joint. So I said to her, what I'm looking at you as a whole. Not just where you're having your back pain. Because sure, I can probably try and work on your back, and will we make it better? Possibly. But when you start to, do your yoga classes, or when you start doing your, hip hop dance classes in 6 months, it's probably going to come back. So what we want to do is we want to try and define the root cause to why she's having that kind of instability in her SI joint and fix it. So was she happy? Yes. So in the end, I discussed with her, okay, so these are the issues that we found that's going on. Now, it seemed like a lot to her, but I said they're all things that we can fix. They're all things that are definitely 100% we can improve. So she went from kind of a, stressed out kind of look to a really happy look, because she knew that she had now figured out exactly why she was having pain on and off for 6 years. So that's kind of like an example, right, of the tire. She'd fix it, she'd stretch, she'd kind of, she'd go for her massages, she'd go to her chiro as needed, and she'd get a little bit farther down the road, and then the flat tire again. So my goal with her, is to patch that tire so she can keep on trucking and do everything that she wants to do. So for those of you who have ailments, have they been around for 3 months? Have they been around, on and off for years? I thoroughly advise you, invest in physio. Get somebody who takes a look at you as a whole, tries to figure out exactly what's going on with you. This is your opportunity. I know it's a tough moment right now. It's a tough life. We're all having good days. We're all having bad days. But physio, this is your chance to take advantage of your health. If you've been suffering for, months on end, take this opportunity to invest in yourself. I can honestly say virtual physio has been eye-opening to me. To be able to show people that they can fix themselves without my hands. Okay? I don't know, it's something about it. It's revelating, the fact that people can invest in themselves and invest in their health and invest in their care just with a little bit of guidance from us is tremendous. The look on people's faces when I get off the phone with them is awesome. When I check on them in a week and they're doing really well, it's awesome. So virtual care is new. Is it? Well, I shouldn't say it's new. It's actually been around for a while. It's just a lot of therapists haven't done it. So this is kind of the new kind of brand that we're starting to see. And I honestly think it's going to continue. Even once this pandemic passes over, you're going to see physios going virtually so that they can empower their patients to have an active recovery and really invest in kind of improving themselves and taking that initiative to be able to learn about moving and learn about how to move, and making sure that, they're invested in their health. So take the opportunity. If any of you guys have any questions for me, if you've had an ailment or that sort of thing for, years on end, shoot me a message. Even if I can give you some advice, I will, obviously. If any of you guys have any questions right now, feel free to post them. I'll try and see as everybody's scrolling through. But invest in yourself, ask questions, take care of yourself, and there's tons of programs going on right now that are free where you can, learn how to move, start moving yourself, walk 30 minutes a day. We're all going to kind of we're all hitting this like stressful, anxiety. Some of us may even have a little bit of like depression symptoms with everything going on, especially since we're social distancing. And they say that walking 30 minutes a day helps with all those symptoms. Walking regularly helps with low back pain. They actually did a study on it. So if you have low back pain, make sure that you start walking. It's just good for your health, good for your physical health, good for your mental health. If you have a chance to do some yoga, same thing. It's good for your breathing. It's good for your mental health. It's good for your flexibility. It's good for your mobility, sometimes stability, depending on what type of yoga you're doing. And like I said, if you guys have any questions about virtual physio, feel free to let me know. I did post a video on our webpage, just kind of deciphering exactly what it is, and it kind of breaks down what you get out of it. But you're more than welcome to shoot me a message, call me, or even email me if you do have any questions. I am more than happy to help. whether you're in Ontario or you're back home or you're somewhere else in the world. I don't mind helping at all. So good luck to everybody, and stay tuned for, I think next week I'm going to start some regular kind of videos and some regular Facebook Lives. If you guys do have anything specifically that you would like me to do a live post on, just feel free to shoot me a message and I'll gather some information and some ideas, and we'll do some lives on anything you guys want. Okay? And remember, I hate public speaking. So the fact that I did this is actually pretty cool. Right? Monica, you know I hate it, right? And I'm pretty sure Heidi knows that I hate it too. Okay, so anybody has any questions? I'm going to watch some TV because I've worked really hard all week. I'm exhausted. But I'm wishing you guys all the best. Please take care of yourself. Stay active. Stay happy. Be patient, not only with your families and your kids, but with yourself. Thanks, Aaron. I love you too. And remember what they say during this period. Stay active. Try and call everybody, somebody once a day. So make contact with somebody once a day. You know what you can do too? Send some mail to somebody. Send some nice happy mail. Thanks, Heidi. I love you too. So stay tuned. Message me if you guys need some ideas. I'm going to get off this because I'm done talking. But everybody have a good night. We love you. Okay? Take care. Bye.